Namaste everyone and welcome to United Hospital Facebook Live. Today with us we have Dr. Lakshmi, who's a consultant obstetrician, gynecologist and a laparoscopic IVF specialist. Good afternoon, doctor. Thank you for being here.
Namaste everyone. I'm Dr. Lakshmi. Already she has introduced me. No need of further introduction. Yeah, we'll go ahead, I think, with the topic now.
Yes. So today's topic of discussion is PCOS. Doctor, what is PCOS?
PCOS is polycystic ovarian syndrome. So before that, we'll discuss about the PCOD. Okay. The polycystic ovarian disease is the presence of polycystic ovaries in both the sides. So this has many consequences and a multiple association. So as and when we deal with the discussion, so we'll get to know in the better picture.
So there is a difference between PCOD and PCOS is what you're saying?
Yes, there is a difference between the PCOD and the PCOS. PCOD is isolated and it usually affects only the ovaries, where will be the formation of thin wall cysts. But in the cases of PCOS, because of this PCOD, we'll be having the further other problem which will be associated. So in detail, when you go into the depth, you will get the in detail discussions after that.
Yes, okay. What are the usual basic symptoms to detect PCOS?
In the cases of PCOD, the patient first of all presents with the irregular periods, majority of them. So they may have problems with the periods or may not have. And the others also, they will be having the formation of male sex hormones more. So this we will term in a medical term as an androgenism. So male hormones, such as testosterone, will be more. Because of this, they can present with the pimples. So in the cosmetic wise, in the puberty age group, they are most bothered with it. And the others can present with hirsutism, that is the presence of excessive hair growth in the other parts where it's not required. So in the future also they can land up into the diabetes because of the insulin resistance. So these are the symptoms where they can actually present to us, mainly the first three whatever I told you.
And what are the basic causes for all these symptoms to be visible?
PCOD. So PCOD, the exact cause actually it's not known, but it can be transmitted through genes also. So it can be a genetic predisposition, and others is most commonly is the hormonal imbalance.
Okay. What are the treatments available?
Treatments, basically, if the patient actually presents with the irregular periods, so depending on that we will treat whether the patient wants to have the regular cycles, or in the reproductive age group she is anxious to conceive. Infertility is the main problem. So we will deal with it, we'll go to the basic test and the hormonal test, and accordingly we will treat them.
Okay. And what is the maximum amount of treatment? How long are the treatments?
Instead of how long, so what their main motto, it depends on it.
Okay.
So in the age group of 12 to 18, if the patients are concerned with the regular periods, so we do have a basic test where we will rule out the thyroid and the prolactin levels, and then we will just counsel them. Depending on that, we will actually tell them you can wait at least 3 to 4 years after the age of menarche, so that the system takes some time to stabilize. If it's in the reproductive age group, depending upon their ovarian reserve and depending upon their background about the partners and her, then we'll go ahead after the hormone test.
After the hormone
so
test.
So it's a wide variety of treatment. So it starts from the simplest being using oral contraceptive pills that will give for the regular cycles. So this is most commonly the whole and soul which is used as a first line of treatment.
Okay.
And apart from it, if you go into the depth of the hormonal evaluation, if she has that positive, it can be a hypothyroidism or the higher prolactin levels or a hormonal imbalance, we will treat step by step, and even the partner evaluation will do.
Okay. There is a very wide notion that PCOD or PCOS will disappear once you get married, once a girl gets married. So how true is this fact, or is it a myth?
Yeah, I think it is a myth. Once the patient has been treated with the OC pills, she can get actually the regular periods. So here, basically, I want to deal with the two main types. The obese PCOS is the one who are very round, and the other one is the lean PCOS.
Okay.
So in the obese PCOD, if the patient reduces the weight, do the diet, follow the diet, and do the exercise, yes, the PCOD, some of them, it will disappear. And for the fertility, that is in conception, it will be easy. But in the case of lean PCOS, we can't advise in the diet. So in such cases, we will have certain steps where we do tell them whatever the diet they will follow, and they won't feel the abdominal discomfort or something. It's basically related to the phenotype. Okay, lean phenotype. So in such cases, the core strength will ask them to increase, and we will see the AMH level. Depending upon this, AMH is nothing but the ovarian reserve, that is the egg count at what age she will be having. Depending on that, we will decide what to be done. Whether with the simplest contraceptive pills do help them. Otherwise, we need to go to the next further monitoring. So it's a next step where it will take the monitoring, that is the egg monitoring, and we will give the injection. The next step will be the IUI, and the last will be the IVF.
Are there any side effects of prolonged treatment?
So prolonged side effects, the common side effects by giving these pills is that whenever they have these vomiting or the nauseating due to the other associated related disease also, it can increases. And we need to rule out the migraine, that is the headaches. By giving these pills, these migraine can get actually increased. And if they're having any associated heart disorders, so that and all we will actually evaluate, and then we will go ahead.
So there's a lot of evaluation that goes behind treatment.
Yes, we do have that basic test. We will do the basic test first, and then we will go ahead whether should be fit for these oral contraceptive pills, and we will even rule out seizures where these pills are contraindicated, and then we will go in detail.
Okay, so it all depends on the patient's lifestyle also?
Yes. Lifestyle modification is the one we will advise them for the obese PCOD, where they have to reduce their weight, do the hardcore strength exercise. Exercise means it's not just a brisk walking or other thing. So they have to do the cardio exercise. They have to sweat out. They have to reduce their weight within vigorous exercises.
Okay, and is there a time limit within which the weight loss has to happen so that the treatment can begin?
There is no weight loss. As usually you know, it depends upon the age the patient actually presents with. If they come at an early age, before actually we had a time where the females used to get early marriage around the 20s or 25. So within 25 they will complete their family. But nowadays late marriage is most common because of their profession, and they want to do the double degrees. They want to go ahead with their profession, higher
to build their career.
Yes, career. So for that, what we will do, if the patient actually presents after 30 years of the age, we need to see and we need to advise them. So if it's after 30 years, yes, they have to take time fast, and they have to reduce the weight and get pregnant. If it's an early, just I think they have to take time, and we have to see in detail and go ahead.
Okay, so that's good to know that there are treatments available even if you want to conceive at a later age.
Yes, in later age, more risk will be there. So we have to actually shorten the period of the treatment. We need to evaluate in detail, and then we need to go ahead.
Are there any complications that you are aware of or you would have come across with so many years of experience?
Complications means these PCOD in the future lifestyle, it's like they can land up into the diabetes due to the insulin resistance. Insulin resistance is nothing but whatever it may have been secreted. So what the sugar levels, what happens in the hyperglycemia, sugar levels will go up because of this insulin resistance. So type 2 diabetes may be the future complication for them, and there will be high cholesterol levels because of the heart attacks and other diseases may become more common. So these things we need to be aware of it further whenever the patient presents with the PCOD.
Okay. So once the treatment begins, how long does the woman have to wait to conceive naturally?
So infertility will define if 1 year without the unprotected intercourse, if she is not able to conceive. So after 1 year without using any natural contraception, if she is not able to conceive, she has to come to us. If the age is more than 30 years, I think better will be the soon without waiting for the natural conception, because for the evaluation and further treatment.
Yeah, because as you said a while ago, anyone who conceives and before the age of 25, it's a little more easier.
Yes. So lesser the age, so that she'll be having time. And if other parameters doesn't go in hand, if the ovarian reserve is too low because of the other reasons, so she's also a candidate. But better sooner the age, I think it will be
the sooner the better.
Yes.
Okay. So this is something that all the women have to know.
Yes.
Apart from building career, it's a lot of your physical health also, which is part of getting treated for PCOD. Okay. With all these treatments, with all these hormonal medications, does the quality of the egg change, differ, deteriorate?
The quality of the egg, when compared to the normal persons, the PCOD, the quality of the egg will be affected. As I already told you that there will be an hormonal imbalance, the male hormones, it will be more. But as the age advances, these testosterone levels actually decreases, which is helpful for the maturation of the eggs. So these do affect in the cases of PCOD than compared to the normal patient who doesn't have PCOD.
So is it something that a patient have to worry about while going through the treatment?
Well, first of all, when they come to the treatment of the infertility, they will be stressed out.
Yes.
So we don't want to actually stress
them
even
out
more after telling them the depth of the discussion.
Yes.
I think they need a positive counseling. So infertility is all about the counseling and the better picture what you will give the patients from the doctor's side. So you need to give time and the proper evaluation and the treatment. I think that has to be.
That has to be there.
Yeah, worrying actually doesn't give the treatment. Right. So the step by step, how we progress and what we will do.
Right.
So that will be better.
Is there any advice that you would like to give all the women out there about PCOD as something that they can look out for?
Yeah. So now all the females do know about the PCOD. So whenever they present to the doctor, first they will say, "Doctor, ನನಗೆ PCOD ಇದೆ, ಏನು ಮಾಡಬೇಕು?" So in that case, so first you sit down, just consult the doctor. Don't be a Google doctor.
Yes,
don't go through the
yes,
unnecessary things.
Absolutely.
So depending upon what you want, that you want to have a regular periods or you are worried about your fertility. So depending on thing, I think we will just treat it. So we need to take it cool.
So it is a treatable ailment. I will not want to call it a disease.
Yeah, it is treatable.
It's treatable, and
as long as the patient actually sticks to the doctor and do
the
follow
advices
all of the
given by the doctors.
Yeah, I think that.
And everybody has to look out for all the symptoms that you mentioned. So the earlier the better, so that the treatment can help the lady also recover faster. And if anybody is into waiting to get into a family, start their own family, so they can also start getting treatment earlier.
Yeah.
Okay. I think we have covered most of the things about PCOD.
Majority of the things what was required. So this is actually a short video, but we do have so many of the things we have to know. So better just consult your gynecologist and the infertility specialist, and as they advise, do go for it.
Yes. So we have Dr. Lakshmi available at United Hospital. Please do take your appointments, and if you have any queries, do consult her. Thank you so much for joining us on a Saturday afternoon with Dr. Lakshmi. Thank you, ma'am, for being here and speaking so much about PCOD. Thank you so much.
Thank you.
Namaste.
Namaste.